Hello everyone, I'm Dr. Gregorio, and today we have a special guest, Angelica Lopez. She's a singer and a longtime friend, and she has a lot to share with us.
Well, I am super happy to be here once again to refresh, to have a more beautiful skin. And we're going to work on these things I have here, the little wrinkles here, these lines next to my nose, to my mouth, a little bit on the nose, the lips, so they look a bit more beautiful. Well, in general, the neck, I would also like to improve it a little bit.
So we already have her case, we already have the photographic planning, and we see a harmonious face with a well-defined fold, skin debridement, meaning displacement of the fat. We already have her case planned out. We can also observe that there is a very strong corrugator muscle and a highly hypersymmetrical forehead. A little bit of excess skin on the upper eyelid. We are also going to assess the neck. We see that there is a very prominent platysmal bend, and this is what we are going to address with dermal filler, in this case hyaluronic acid dermal filler. A little bit of volume and projection for the malar and temporal areas. We are going to place some barbed threads to create traction and a lifting effect on the nasolabial fold. And these are the areas to be respected when performing a lifting, a brow design with botulinum toxin, in this case a frontal botul lifting. And that's what we have planned for today. So now we're going to get her ready. Now we're going to plan what we had mapped out in the image. And we'll start designing for the botulinum toxin, for the frontal lifting. Frown for me, frown. And now we're going to mark the design where we'll place the little points of toxin. In this case, we leave this muscle free so we can achieve a complete brow lift and improve the expression lines of the crow's feet. And this excess skin we have here, so this here is the design for a frontal lifting with botulinum toxin. We're going to improve the platysmal bands. Very good. Now we are at the facial lifting stage, botul lift, and we're going to do the frontal lift, starting step by step. We're going to do the botulinum toxin part, where we'll design the arch of the eyebrows. We can see that she has a bit of excess skin on the upper eyelid and looks straight ahead. This excess skin will be improved by reducing the pulling force of the frontalis, performing only a concentric relaxation of the frontalis muscle and leaving this part of the frontalis free, which allows us to achieve a lifting effect with the toxin and also to release a bit of a space for the periauricular muscles. And then we move on to the next part of the procedure. For now, we'll start with the toxin and relax the platysmal bands a little. We're going to reduce the masseter a bit since it has a slight excess in the masseter to give her face a slimmer, more refined, sharp, slim face. Let's get started. And we'll give a few little injections here to improve the expression lines on the lower eyelid. Very mild, very gentle. There shouldn't be any pain because she's anesthetized. And we're using a very small hypodermic needle, which helps the patient feel less discomfort.
Of course. Yes, we have the best doctor in the world.
We just finished the botul lift. Now we're going to plan for the lifting effect using cork threads. Okay, polycapodactyl, and we're going to create the lifting design, in her case We're gonna make a small entry point here to move this fat that shifted it, used to be here, and moved over here, and we're gonna create a lifting effect to reposition it back here. And we're going to use 2 small cannulas. And we're also going to create a lifting effect here to improve the neck at the same time, as well as the entire lower third area, with definition of the jawline and lift of the cheekbone. And this is the effect and result we want to achieve. We already have the markings to do her lifting. She's all numbed up with her anesthetic points, infiltrated, and we're starting to insert the polycaprolactone thread cannula, bar polycaprolactone threads. This will give her a softer effect and a lifting effect. And we'll also see some collagen stimulation, and at the corners of the skin is one side. I'm going to be mixed. I'm in a neighborhood. I don't want to be a slave. I'm doing crap at home, and the glide is a good way. It's a great way. As we can see, we've already done a lift. We did the lifting of the jawline and the neck, and a repositioning of the malar area and the little fat that hadn't been removed. We now try to move it more toward the malar area, and you can see the result. At this point, we already have half the face done, and we only at the lifting part with threads. We can notice that there are more details in the jawline and more definition in the malar region, and the nasolabial fold is less noticeable. Okay, so now we can see that we've already done the lifting on the right and left sides, and we can already see the lifting effect on the jawline and the malar area. Both sides of the face are done now, and next we're moving on to the lips. We're going to work on the upper lip and the lower lip. We're going to create a very beautiful, very subtle design, since this is someone who works with the public and we don't want it to look exaggerated. We've already finished the lips. They're a little swollen, but this is the result of a lip augmentation and reshaping. It's something subtle, just a bit puffy. Let's wait a few days to see how it turns out, and then we'll move on to the nose reshaping part. We've just finished the procedure. We did a non-surgical nose job, and we did a projection of, and this is the result after the treatment. Now we just have to do a mesotherapy session, and we'll see the final result of the mesotherapy. Vitamin C to improve the pores a bit, antioxidant, the skin looks beautiful, and a little bit of toxin to improve the skin's texture. This treatment is a mesobotox procedure that incorporates vitamin C, and it is followed by the application of a soothing cellulose mask to enhance the overall result. So today we're here with Angelica, and we're going to do a follow-up on the previous treatment. So let's assess the facial muscle movements in the forehead. Raise your eyebrow, give a big smile. We can see that the periorbital muscles have relaxed, the so-called crow's feet. Give a big smile. Wrinkle your nose. That's it. Tense your neck. So we're just gonna do a touch-up in some areas to slightly improve, relax the platysma muscle, and release a bit, lift a little the lateral part of the eyebrow. We are all set, and we've already applied some anesthetic cream. We're gonna slightly reposition the malar fat pad here, moving this little bit of fat with a thread, and we're going to restore this area of the temple with a bit of filler. This lack of volume we have here, we're going to restore it with a bit of filler, and we're going to create a bit more of a lifting effect using a double cannula thread. Over time, our bones get resorbed and we lose material bone, fat, and tissue, and this area becomes more concave. As a result, the fat that is higher up detaches and moves or shifts downward. That's what creates the marionette line and the jawline due to the loss of fat and tissue. So what are we doing? We're restoring a bit of this tissue that you can see. This here is a barbed suspension thread with a double cannula. So we worked on the temporal area with a small brow lift using threads with dermal filler and hyaluronic acid. And we already placed a double cannula thread to move the malar fat pad to reposition the fat from the cheek. And this is the effect that we see. Now let's move to the other side of the face. We did the other side of the face. You can already see the lifting effect. Now we're going to reinforce the nasolabial fold with a little bit of argan steel. We're going to finish the procedure, and this is the result of the procedure. We also want to avoid swelling, so we'll apply a cellulose mask to reduce inflammation, and soon we'll see the final result. Hello everyone, so today it's been 15 days since the post-treatment, and we're going to do her evaluation, the checkup, and talk a bit about what we did and everything that happened during the course of the treatment. Everything is very symmetrical. Raise your eyebrows, frown, smile. We managed to achieve a natural lifting effect. We reduced the expression lines on the forehead, the glabellar lines, and the expression lines in the lower eye area. Also, we worked on the crow's feet, and we also did cheek lifting, definition of the mandibular line. And we did this with threads and with dermal fillers, and this is the result after 15 days. Now let's look at the analysis of before and after. And we see her in a natural state without movement. We observe the movement processes, corrugator, hyperkinetic, forehead, hyperkinetic, lateral lines of crow's feet, hyperkinetic with drooping eyelid, platysma. This is the view before performing the treatment. This is the view after the mini lifting with support threads. This is a view of the dermal fillers we treated, the tear trough, the area under the eye, the nasolabial fold, and the zygomatic ligament. We restored volume in the temple and slightly enhanced the malar line. We also performed the lip lift and the lip contour. And now let's look at the final result. Is this the current result? We can see the lip is symmetrical and proportionate. We also did the nasal profile, the tear trough, the zygomatic ligament, and the nasolabial fold. So you can appreciate it with movement. We can see that she is here in motion, You can notice tiny expression lines, fine lines in the smile. Comparison with the previous photo here, she's trying to frown. We see that there is no expression line, but there is a natural movement and a symmetrical raising of the eyebrows. And that's all, dear ones. This is her final result.
As always, I am very happy with the result. First of all, because I trust the best doctor. Gregorio is the best, and I wouldn't let anyone else. My not health, not my face, not anything, just another person. Truly, I am always happy, always satisfied, because it's a very natural way to enhance each person's beauty and above all to take care. And the best hands are Gregorio's. There is definitely no one like him, and no one else will touch my face. Other than you, no one. It's that simple. Very happy, as always. He is 100% recommended. He is the best in the world, not just in England. The world, the best in the world.
Thank you very much. Thank you very much.
That's it.